I'm Dr. Brian Druker, the director of the Oregon Health and Science University Knight Cancer Institute. I'd like to welcome you all to the 12th CML Horizons Conference in Serbia, and I apologize that I can't be there with you today. It's hard for me to believe that it was just over 20 years ago, as I was transitioning from Dana-Farber Cancer Institute in Boston to my present institution in Portland, Oregon, that I had a goal. And that one goal was to identify a company that had a drug that could shut down BCR-ABL in CML and bring that drug into the clinic. Now, you have to realize that 20 years ago, not a lot of people believed that was possible. A lot of people thought that drugging this protein BCR-ABL wasn't going to be possible, that it wouldn't work, and least of all, that it would never make enough money to make back an investment in the drug development. But fortunately, I was able to make one phone call to my good friend Nick Lydon, who was then at Ciba-Geigy and is now Novartis. And they actually had exactly what I was looking for. They were developing drugs of the type that I was looking for. They sent it to my lab when I moved to Oregon. And within 6 weeks of arriving in Oregon, I had a compound that killed CML cells without harming normal cells. That drug would become Imatinib or Gleevec. Now, as I mentioned, there were several hurdles along the way that kept us from going immediately to clinical trials, but ultimately we did. And you know the story, and you're here surviving because of the work we did, but within 6 months, every single one of our patients was responding. And now when we look back almost 12 years after the FDA approval of Imatinib or Gleevec, we now have 5 drugs to treat patients with CML. I have patients in my clinic who are 20 years from diagnosis. Our longest patient on Imatinib is 15 years on therapy and still doing well. The conversation has now changed from a 3 to 5 year prognosis to essentially living a normal lifespan. And that conversation has forced us to think about quality of life issues, thinking about all the other things that might happen. It's forced us to think about optimizing therapy. How do we monitor our patients? But equally as important, how do patients around the world get access to these life-saving medications? And lastly, it's also forced us to think about how do we take control of this leukemia to cure? And all that was made possible because of the very early research that went into identifying the target, identifying a drug, and then bringing that to clinic. And you're here as living proof that targeting cancer without harming normal cells is possible, that understanding what drives the growth of cancer gets us to this better place. Now, having looked back at this over the past 20 years, I still feel incredibly fortunate. I still see patients 1 day a week. Many of these patients are 20 years from their diagnosis, and they're just this living proof of what we can accomplish. And I especially want to thank all of you for all the work that you do, trying to advocate for patients, trying to help patients through their journey, newly diagnosed patients that are oftentimes afraid, need some time to adjust to this new bump in their life. But as you know, patients can get through this. Patients are doing incredibly well. They're surviving and thriving despite this diagnosis of a leukemia. And I hope that you continue to do this incredible work in bringing this treatment to as many people around the world as possible. And I hope that you continue to do this important work of your advocacy. Again, I apologize I can't be there with you, but I certainly am there with you in spirit. Thank you very much.